A revolution in natural medicine is underway, and Blue Earth Medicine podcast featuring Dr. Jill Johnson and host Brad Johnson will lead you on a fun and interesting journey into naturopathic medicine. The information in our podcast, articles, or videos are not intended to replace one-on-one relationships with your personal healthcare provider and is not intended as medical advice. We encourage you to seek advice from your naturopathic doctor or healthcare provider. Thank you for joining us, and we're glad you're here. Welcome to the Blue Earth Medicine Podcast. We're coming to you from the Pacific Northwest in our Seattle area studio. We're your hosts. I'm Brad Johnson, and with me, naturopathic Dr. Jill Johnson. And together, we'll explore the world of natural medicine, take a deep dive into health topics, and give you tips and tricks to stay naturally healthy and have fun doing it. In this episode, we're going to explore the time-tested treatment created more than 100 years ago, probably a lot longer than that, and it's currently experiencing a renaissance. It's called water therapy. I'm excited to talk about this, Dr. Jill. Maybe we start at the beginning. And
right.
let me I'll just introduce the question here, and then you can answer along. So I know we've been talking about hydrotherapy for a long time, water therapy, water cure. And so over the past several years, there's been a lot of talk about cold water plunges. You've probably seen it on social media posts where people jump into tubs filled with ice cold water, or they plunge in a hole through cut in an ice lake. And and perhaps most likely folks have seen Wim Hof, the noted Iceman. He's brought a lot of attention to this and popularized this as a kind of a current health fad. But water therapy, sometimes called water cure, sometimes called hydrotherapy, has a long history in naturopathic medicine. Can you give us a quick kind of overview of what's been going on historically in this area?
Yeah, a little bit. I think I've read information that says there's some information, some record of ancient Egypt, there being use of water to helping heal people. So I don't know exactly about that. Where we start looking at, where naturopathic medicine really starts looking at water cure or use of water to help heal is with a guy from the early 1800s. His last name is Priesnitz. And basically he was located in what's now the Czech Republic. And as a kid, he grew up on a farm in this very rural area, and there were some local doctors that used water, and so the thought is that maybe they helped teach him how to do it. But he would walk in the mountains with his family's cattle, and the story goes, he saw a deer, a wounded deer in the mountains, and saw it actually put its wounded leg into a cold mountain stream, and saw the same deer come back to the same spot day after day until it was healed. And it gave him ideas about how to heal his own animals, so he started using that with his animals. There's also a story about he got into an accident with a horse cart where he broke a couple of ribs, and the local doctor said, well, there's nothing I can do about it. You're gonna die, really, basically, is what he said. And so he took to water cure and would bind his ribs very tightly with a cold, wet cloth, and he cured himself. His ribs healed, and he worked his farm, and people started coming to him to heal. So that's pretty early on and pretty amazing. There's a lot of different people. I'm just going to kind of jump around a little bit. Another very well known, and in fact there was in the early, I think it was mid 1800s, priest in Germany called Father Kneipp. He was healing people from all over the world, and he did not accept any money. He was the healing priest, the water cure priest. He did a lot of writing as well. So if you see books called My Water Cure, that's Father Kneipp from the 1800s. And it's claimed, and I don't see why this would be questioned at all, that he helped heal the Archduke Ferdinand of Austria.
That's so cool.
Yeah. So, and then we kind of jump into more the 20th century. O.G. Carroll, who's more local to us here in Washington, he also was a sickly child, had rheumatic fever and juvenile arthritis, and ended up getting healed through a physician who used water cure. He started learning botanicals, herbal medicines, and trained to be a naturopath, and came to Spokane and started the first water cure naturopathic type of clinic in Spokane, which is actually still being run to this day, called the Windrose Clinic in Spokane, Washington.
Talk about a little bit of a lineage there.
Yes,
This is really historical. It's so cool that it's here in the Washington State,
yeah,
in the little town of Spokane.
Right,
Not so
right. And the woman that runs it, her father worked with Dr. O.G. Carroll, and Dr. Carroll he created or invented a system to test for food intolerances, as well as what's called constitutional hydrotherapy. And basically it's just hot water and cold water towels laid across the abdomen and chest and then across the back. So basically it's a contrast, hot water or hot compress, cold compress, with some very light electrical stimulation to certain areas along the back. So this therapy done in terms of trying to heal will help people heal many ailments. And he healed a great number of people over his years, and his constitutional hydrotherapy is still being utilized by a number of naturopathic physicians to this day.
That's so cool. So this is something that you learned while you're in naturopathic medical school. I think it's a common, I'm not sure, I can't speak for all the medical schools, but I know Bestier had taught hydrotherapy in their doctor classes.
Right, yeah. So we had a whole class on hydrotherapy. It was, so there's a group of types of treatment called physical medicine. Think of physical therapy, chiropractic, that kind of just hands-on treatments, and hydrotherapy was our very first. And so we learned a number of different ways to treat pain, inflammation, illness using different forms of water. Yeah.
So I know in Germany they still rely heavily on hydrotherapy techniques, and there's places where you can go for treatments. I mean, you went to our local motherland over to Spokane and received some advanced training in hydrotherapy, and this is something that patients really benefit from what I can gather.
Yeah.
So maybe talk a little bit about some of the benefits people walk away with.
Yeah. So there's benefits. So you can think of water as either cold water or hot water, and you can use them, like I mentioned, with constitutional in contrast. So hot, cold kind of thing. But some of the benefits from cold water, you can reduce inflammation. If you've ever put ice or ran your hand or something under cold water, you're using water to help heal.
How many of us have burned our hands? You're cooking, you burn it. What's the first thing you do? You probably plunge it in your mouth, or you run underneath some cold water in the sink. Yeah, that's
cold
almost
water.
like an innate thing, isn't it? It's so crazy.
Yeah, and so something as simple as that can really help reduce inflammation. It can reduce pain, of course. Reduce inflammation, we can lead to that. It also, in certain applications, can reset the nervous system. That constitutional hydro I was talking about helps our parasympathetic nervous system, the rest and digest system, actually reset. And that system helps us relax, rest, and helps us digest our food. That's all part of the parasympathetic nervous system. Kind of when that dominates, we're able to perform, or we feel those effects. And so if we're resetting the nervous system, we also can improve our mood. We can reduce anxiety. It can help increase our energy. This is all cold water stuff. It's been shown to reduce headaches, increases blood circulation with the use of hot as well, increases white blood cell activity. It stimulates that, which is really our immune system support, which helps our immune system do its job better. So cold water is pretty amazing. And hot water, if you think about, have you ever just come home from a hard day's work? I just want a hot bath. That's hydrotherapy, folks. That's you're helping heal yourself. So
it seems like a lot of these things we don't even realize. We just almost intuitively or innately just know that.
That's what we need.
Yeah.
And it seems funny to think about it in terms of healing. Like, well, I just do that. Well, in a way, yes, you are helping your body heal. And there is some intuition there. We know this works. How did a deer know to put its leg in a mountain stream? It knew intuitively that, or innately, that it's going to help. Right?
I love that.
So other hot water cures, it can help improve sleep, that relaxation. It also can reduce headaches depending on the application of it. It can help us clear respiratory infections, break up, like steam, for example, can break up thick mucus and help us cough it up, get it out of our noses, all that good stuff. So there's a lot of benefit to cold and hot water.
I think this is so cool. I mean, talk about the most basic way of healing is just using water. And of course, it's difficult for like mainstream conventional medicine that's like, I'm going to prescribe you some water. I don't see that happen a lot. But in naturopathic medicines, docs will prescribe water cure, hydrotherapy. That's ridiculous, the benefit that people receive from doing this. So it's free. It's really, you can do a lot of this stuff yourself, which is really, it's not a great business model, but it's a really great medical model that helps people take care of themselves.
Right. Yeah. And one of my goals as a naturopathic doctor is to help patients help themselves. So if I can help somebody ease their joint pain, for example, I have knee pain. Well, at the end of a shower, turn it on cold and blast your knee with some cold water. Put a cold compress on it. It can help. Yeah. It can help a lot, and I've seen it help people.
Yeah, I think that's amazing. I know, people get little back injuries or maybe like a twinge of, maybe a rib goes out of place, or you can kind of pop it back in place and it still hurts. Applying some water therapy to that area that's maybe inflamed, and maybe you don't see it on the skin, but it's definitely, getting a lot of attention from your body.
Right,
so cold water would probably be a thing to consider. I'm not a doctor. I'm just throwing things out there.
Yeah, I mean, initially cold water, any injury, you don't want to put hot water on it for at least 24 hours.
That's probably worth repeating.
Yeah, any injury, you do not want to put hot water on it for at least 24 hours, 48 hours, maybe even better. You can use cold. Okay. No hot water on injuries.
Why is that?
It's going to bring more blood. So when you have an injury, there's a lot of blood that comes into the area. It becomes red, hot, inflamed, painful. When you add hot water to that, you're bringing more blood into the area, which you really want to minimize. That could lead to increased pain. Increased blood in that area is going to put more pressure on nerves, which then could lead to more pain.
We don't want that.
Right. Cold water, what cold will do, and I really stress cold water. It's preferable to ice, even though we're told put ice on it. Cold water is preferable. That's going to help constrict blood vessels, which will minimize, at least for the first day or two, it will minimize blood flow. It's going to help minimize signaling through the nerves, so it will help reduce pain. It'll reduce inflammation, but and it'll allow us a little bit easier movement. So after the first day or two, you're starting to heal already. I mean, from the very beginning, you injure yourself, you're already, right after, you're starting to heal, whether you feel it or not. And so after a day or two, you can start adding that heat and doing this contrast of warmth to the area, which brings blood into the area, and then cold, which constricts blood vessels and pushes the blood deeper into the injury area. What that does is the heat brings water toward brings blood toward the surface, removing it from the injured area. It removes, during an injury, you get cells that get broken apart and toxins that accumulate and all kinds of stuff that accumulate in that area. You want to remove it. And so warmth helps bring the blood toward the skin, removes all those toxins from that area without causing more damage. Cold then constricts blood vessels, pushes blood toward the injury to bring oxygen, to bring healing nutrients, all of those things that are needed for healing of that injury into the area. So you do a contrast, hot compress, for example, or hot water for 3 minutes, cold for 30 seconds, 3 minutes hot, 30 seconds cold. 3 times you do that hot, cold, and you're basically forming this localized blood pump that moves blood in and out of the area to help you heal faster.
That's awesome. So I want to circle back to something. So, I remember being in football and stuff. There was put ice on it. You want to tough it out, and I always hear put ice on it. So you said something about avoid the ice, use cold water. So can you talk a little bit about what the ice thing's about?
So ice is preferable to nothing.
Okay.
Now, water can get absorbed. Ice, we tend to leave ice or cold on for longer than we should.
Okay.
And so with ice, that can actually damage the skin.
Okay.
And maybe not damage blood vessels within the skin, but it can certainly, if left on too long, it can cause the blood to stagnate.
Oh.
And we don't want that. We want blood moving in and out of the injured area as much as possible.
It seems like this show here, this water cure hydrotherapy show, is like something that, if you haven't, folks, please share this podcast with your friends, because this is really valuable information that everybody should have. Everybody that has a family, anybody that has a body, ought to know how to take care of themselves, and this is really some fundamental stuff. So we talked about, at-home treatments, and this seems like a perfect segue to talk about what kind of things can we do at home using water as a treatment.
Well, I've mentioned compresses, and I want to let everybody know what a compress is if you don't. Basically, it's just taking a cloth, whether it's a washcloth or a small towel or whatever size is going to cover the area you want to treat, and soaking it in either the hot water or cold water, whichever one you're using. Wring it out and place it on the area. That's all a compress is.
Okay. When you say hot water, do we want our hands to go, ow, when we put it underneath there?
We want as hot as we can tolerate.
Okay.
We don't want to place it on our skin and burn.
Yeah, we're not trying to prove anything here.
No.
We're just trying to get nice and warm.
We also don't want to place it on our skin and only be able to keep it there for 2 seconds. We want to be able to keep it on there for 3 minutes at a minimum. And have it be warm, hot, but that you can stand it, that you can tolerate it. Anything hotter than that could cause damage, so you need to be careful with that.
You talked about compresses. I know some people put herbal, maybe herbs in it.
Yeah, so you can basically make a tea with herbs, and if you're wanting to learn more about herbs, talk to your naturopathic doctor.
There's lots of books out there.
There's lots of books out there about healing herbs, at-home herbal remedies. Those are great things to have, and to have some healing herbs on hand. Yeah, so you'd basically make an herbal tea and soak your cloth in it and cover the injured area.
Cool. What other kind of at-home treatments do you think of?
Well, so we can look at body parts. So pretty much compresses are more smaller areas that you're looking to treat, like your legs, arms, knees, ankles, that kind of thing. You can use immersion or submersion. So you can get a foot bath, for example, is a treatment. You twist your ankle, you put it in some cold water. That's a treatment.
Like, I've seen things in stores where you can get them. They have bubbles that roll up through them. You can plug it in, or you can just get a plastic container from
Tub.
Yeah.
A basic, plastic.
Yeah.
Rubbermaid tub.
Yeah, you don't need to make a huge investment. I mean, these are things you can do right now.
No. Yeah, so those kinds of things you can do. If you're looking for a more whole body, and I think Brad mentioned Wim Hof, and you see people like submerging their whole body in the ice bath. You can kind of do that. I would, if you're new to using water as healing, or cold water especially, I wouldn't jump right into an ice bath. There is a way to do that. You need to have your body warm before you do it. So whether you're exercising, jumping around so your body gets warm, you can also sit in a sauna. Sauna is actually a type of water cure or water treatment. And that heat helps you sweat. Sweating helps you get rid of toxins and waste products, metabolic products that your body can't utilize and maybe doesn't get rid of it very easily any other way.
We call the skin the largest
organ of the body.
Yeah.
You wouldn't think skin, you never think of skin as an organ.
Yeah.
But skin is an organ, folks.
In terms of elimination, getting rid of the nasty stuff
right.
out of you. I mean, if you've lived on McDonald's food for a while, then you say, okay, I'm going to go off that and go clean and go in the sauna. You may start finding yourself being a little smelly. All that smelly stuff is all that crud coming out of your body that you're removing. So
it's a great elimination organ.
Yeah.
When we don't often think of our skin as being eliminating stuff from our body, but it because it's the largest organ and there's so many sweat glands, sweating is one of the best ways to get rid of stuff that we want out of our body.
And saunas are relaxing, and you see people, especially the good Finnish people, they've got it dialed in. They've got a sauna next to the ice cold water. You do a plunge after you've been in there for a while. They don't do it the other way around usually. You don't go in cold, you go in hot, then cool.
You get hot first, and this is for any kind of contrast type of therapy you're doing where you're using hot and cold. You start with hot, and then you go into cold, and you always end on cold. I'm going to repeat that. You always end on cold, never on warm or never on hot. And that's because of the blood stagnation thing I was talking about earlier. We got this good pump going, and then all of a sudden we go, and our blood really, it doesn't stop moving, but it's going to slow down so that it's not as effective. So we want to end on cold.
Yep. So we talked about sauna. What's the next logical place to go?
Hot tubs. A lot of people, just a hot bath. Sometimes we can induce sweating just sitting in a hot bathtub. But if you have a hot tub, even better. You can more fully submerge, a hot shower.
Hot spring,
yes.
My preference is hot spring. I love the natural hot springs that we find in certain parts of the country. Colorado's some of my favorites.
Right. Hot springs are great. It's great to have some kind of cold rinse or cold plunge following something like that to not only cool yourself down, but also to help circulation, to help get that blood moving a little bit more throughout the body and help your body heal whatever may be going on. Maybe you're not really feeling anything, or you feel like, I don't really feel right. maybe doing something contrast with a hot tub and a cold rinse can help.
Okay. So you've talked about contrast hydrotherapy. That's the 3 and 3. You get 3 minutes of hot, 30 seconds of cold. Do that 3 times. That's contrasting over a specific part of your body, right? That's not your entire body.
It could be your entire body. Yeah. Yeah.
Why don't you tell me a little bit about constitutional? Maybe that's not something that you would do at home, is it?
There is a way to do constitutional hydro at home, but basically what it is it's a contrast hydrotherapy. So we're using towels that are soaked in hot water and wrung out, placed over the abdomen and chest with a little bit of light electrical stimulation with some pads that are under your back.
Well, these are things that you would find at a naturopathic
yeah,
doctor's
this
office.
is probably not something you can purchase out there.
Yeah. But a lot of traditionally trained naturopathic physicians do constitutional hydrotherapy.
Right. Yeah, they're going to have the
effective.
equipment.
Yeah.
You have to, there's a certain way of doing it. You have to cover with a wool blanket, and it has to be wool. I mean, it's very precise in how many minutes you spend with the hot towels on, how many minutes with the cold, and when the electrical stimulation is introduced and when it's not. This is one that really does reset the nervous system. So if you're somebody who has been feeling anxious as we're coming out of the COVID pandemic time, a series of constitutional hydrotherapies in a naturopathic office could be really helpful to help mitigate, along with other things as well, but to help mitigate the anxiety you may be feeling.
Right.
So that's a great thing. It also is really great for digestive health. Okay. It helps with healing the digestive system. Again, we're stimulating the parasympathetic nervous system, that rest and digest system. And so it's really helpful for those types of things: anxiety, depression, digestive issues.
So
leaky gut.
I'm going to interject here about how this constitutional hydrotherapy really is effective towards these things we were just talking about. And like we don't talk about. Okay, I'm going to say it. We don't talk about poo very much, and
No.
That's one of the easiest things. I mean, if you look in the stool after you've dropped a deuce, and is it gray? Is it light? Is it tan? Is it
Right.
does it have structure? Is it loose? I mean,
Is
those
there
things
food in
really
it?
tell
Is
you so
there-
much about your health, and we
Right.
don't really talk about that.
Yeah.
And so I suspect we'll have a poo episode down the road, but that's
Yeah.
if it's not, you can talk about this. What's good poo?
Yeah. So I would recommend looking up the Bristol stool chart.
Bristol stool chart.
Yeah. And the color should be brown.
Okay.
Now, color can shift. I mean, think about the last time you had beets.
Mm-hmm.
You can see some red in the toilet, right?
That can freak you out.
So foods that you eat, really dark, very deep, rich colored foods can make your bowel movements, make your stool a different color. So just pay attention to that. But if you haven't been eating anything like that and the color's yellow, gray, kind of pale,
Or if you have explosive.
right, diarrhea, explosive diarrhea that's consistent, there is something that,
That may be common for you, but it's not normal.
right. So there are these things that can be considered common. Well, that must be normal because I talk to so many people and a lot of people have the same issues I do. Well, talk to your healthcare provider because certain things can be common, doesn't mean they're normal. And many things that are common are normal, don't get me wrong. But check with your healthcare provider if you have things that just don't seem normal. A normal bowel movement, normal stool should be well formed, not liquid, not hard little pellets, and should be easy to pass. It shouldn't take you much effort. You shouldn't have to push. And it should be brown in color.
Well, I took us on a little side trip there, so sorry about that, folks. But
That's right. We're talking about water.
We're talking
here.
about water, but we talk about digestive system, and that just popped in my head. I think it's always worthwhile to cover important things, and they present themselves. So,
yeah.
Any other sort of home treatments that you would like to share or talk about?
Well, one that's come up more recently because I hear and see a lot of people that have congestion, like nasal congestion, sinus issues. There's a lot of RSV going around and flu and all kinds of colds and things that get our sinuses all stuffy. So neti pots, if you've ever used a neti pot, that is a really great treatment, especially if you just have regular sinus infections or your sinus is just pain. Neti pots can help thin mucus, decrease inflammation within that area so those sinuses can drain. Steam can help you immensely, where you put a towel over your head and put boiling water in a bowl and you just breathe in the steam.
Yeah, be careful doing that, of course.
Yes, be careful with steam. Just be very, which is not appropriate for children to do that type of steam treatment. But get a bathroom nice and steamy. You can bring a kid in there, and that's okay to do. You can keep a humidifier in a bedroom.
Keep them clean. Clean them up.
Yes, clean them out. Those are all water treatments. That's all I'm saying.
Yeah.
Those kind of rinses. I mentioned compresses. There are hyperthermic baths, if you've heard of peat baths. Basically, it's really hot water with peat, so dirt in it. Basically, it has lots of minerals. And
is that something you do at home?
You could. I would recommend a really good screen for the drain, because you don't want that going down your drain. But many people find that to be really healing.
Interesting.
And that was something early on when AIDS and HIV in the early 80s, that was something that was helpful, that Bastyr did in their clinic. They helped people with those viruses, or that virus, because hospitals wouldn't take them and doctors wouldn't see them.
Right.
And so Bastyr developed a peat bath treatment.
Okay.
So
awesome.
Yeah,
really
it helped with viral load, diminishing that.
I love see naturopathic schools and clinics really advance.
Me too.
Push the envelope.
Yeah.
Helping people.
Yeah.
Not saying, we can't do anything, we're just wringing our hands. Here's something we can do. I love
Right.
How often do we need to apply water therapies to help our health? What frequency would we do this?
Well, it really is going to depend on what's going on. If you twist an ankle, for example, applying cold water, remember, first 24 to 48 hours, you could do that multiple times a day, 3, 4, 5 times a day, to help with that inflammation and moving blood. Typically when I give a prescription, something like that, I would say 3 times a day. Contrast, that can be hard to do, so whatever works for you.
Right.
If once a day is all you can do, once a day.
Right.
If only 3 times a week, then 3 times a week. It's going to help.
Right. So if your conventional doc puts you on some sort of anti-inflammatory, you could still do this, and that wouldn't be a problem. Okay.
Yep. Yeah. I mean, water is, unless you're applying the wrong temperature of water, I would caution against that. The wrong temperature, like you're chilled and cold and you jump into a cold bath, that's not
a good idea.
I would not recommend that. That could make you sicker.
Okay.
Do not do that.
Right. Well, good.
You
I mean,
know?
I just want to make sure that all of our bases
Right.
are covered because I know some folks have questions and I
Right.
have questions. That's why I ask.
Right. Yeah. Yeah. So yeah, if on medication, if you're really struggling illness wise, talk to your naturopathic doctor. You know, some types of water treatments like hyperthermic bath, like a peat bath, for example, I would not recommend for somebody who has heart failure.
Oh, yeah.
You know, or well, yeah, any kind of heart failure or heart disease that could put a tax on the heart, and so you really need to talk to your healthcare provider, preferably a naturopathic doctor, to help you figure out how to do water cure the best for you.
Right. So much of what naturopathic medicine is really preventive medicine. It's keeping you healthy so you don't have to come into us when you're sick or when you've like gone way over the sick line.
Right.
And you know, so if you are keeping up a regular routine of, you know, keeping your immune system honed and exercising, eating right, eating the best, and you know, the best we can, and everything in moderation, I think, you know, is probably a pretty safe thing to say.
Right. Yep.
You know, if we can stay healthy, then we can avoid a lot of these problems down the road. But if we keep pushing it down the road, it's like we can treat ourselves with so many things here. Hydrotherapy is just a
Stuff
good
that
example.
is, well, we all pay for water, right? But
Yeah.
it's in your home.
Yeah.
It's available and easy to get.
Awesome. So if I wanted to do things like and we'll talk about cold water blasts in the shower, is that something we can do every day, or?
Yeah, so I started doing a cold blast of water at the end of my shower every day. In fact, anytime I take a shower now, I can't just turn the hot water off. I have to give myself a cold water blast.
I wonder how many people are like going, "Oh my God, I couldn't do that," or how many people do? Yeah, I do that. If you guys, if any of you do this, let us know because we're really curious. You know, post it on Instagram or on our Facebook or on the comments here on our
great
our
idea.
podcast. I would love to hear about that.
I'd love to hear how many people out there do that.
Yeah. But that's something you can do every day.
Yeah, and the thing is, you don't have to, and I wouldn't recommend starting with extreme.
Yeah.
So, you know, you're taking a hot shower, it feels great. Don't go to the cold. Don't just turn it all the way to cold. I would recommend just turn it down to a little bit cooler than what you had during your shower. And just rinse your whole body. You know, if you're okay rinsing your hair with cold water, rinse your hair. Face, you know, chest, abdomen, back, all of it. And as you continue that, if you do that on a daily basis, really what this contrast hydro or cold blast is just a difference in temperature. So from the hot to a little cooler. And as you continue, you might find like, oh, I could maybe try a little bit colder. You know, maybe once a week you say, you know, let me try a little bit colder, see how I do. And you can start with the cold like on your legs and just kind of move into it, or on your arm and move into it a little bit more. It doesn't have to be your whole body either. But if you're interested, try it. I'd like to hear too.
Yeah.
Like how many people have started.
Yeah.
And what do you think?
That's our cold blast challenge.
Yeah. And I mean, it's different in the winter. So you might say, oh, this summer I'm going to start doing that. But if you've ever like sat in the sun and you get hot and you jump in the cold lake, one of my favorite things to do, by the way, that's basically what you're doing. You're getting hot.
Yeah.
You jump in cold. You get back out. You get hot. You jump in cold. It's great.
You're doing hydrotherapy, folks.
You're doing hydro. Yeah.
Is there a minimum or maximum time for this therapy to be effective?
Well, so it really depends. Again,
Sure.
it depends.
Well, that's the thing.
It depends on what you're doing. if you've got chronic illness, for example, it's taken you a long time to get to this chronic illness, and it's going to take probably not just water to help make you feel better. It's probably going to take a number of different things. So I would say in general, the sicker you are, the longer it's going to take. If you're trying to heal like an ankle sprain, or you broke an arm, I mean, breaks take so long, right? That's going to take less time because it's more of a, this is what happened right now. It hasn't been an ongoing thing.
Right.
So it really depends on what you're trying to do. It could take, I always say, we need to really try something for 3 to 6 months before you may even start seeing any change in symptoms.
That's tough. It's tough because our attention span has shrunk from like 12 seconds to 8 seconds in over 20 years. So we like quick. I think that's one of the beauties of the business model that conventional medicine follows, is that I can give you a pill, it makes the thing gone, but it doesn't go away. It goes down deeper. And ultimately, if you've been experiencing pain or having some sort of chronic problem for decades, you're going to come to a naturopathic doc and they're going to say it's going to take a while. It's just that's just the nature of it. It's just going to take a while, but you got to be committed to your own health. Take the steering wheel and trust your naturopathic doctor that they have the compass and they can guide you in the way that brings you back to health. And it may not be 5 minutes, but just because you don't feel the pain doesn't mean it's gone. The injury's gone. So, heed the messages that you may not be necessarily straightforward, maybe subtext, but that's why I'm bringing it up to the surface here. It's really important to hear that. It sucks that it takes a while to get better, but if you want to get better healthy, naturally, it's going to take as much time. It's going to take a while to dig yourself out of a hole.
Right. And like I said, with chronic illnesses, it's been going on for a long time, and so it takes a long time to basically dig yourself out of that hole, climb up out of it.
You can do it. You got a support network right here. Well, I was kind of a quick little plug for you here. Dr. Jill she's a general practitioner, specializes in family medicine, chronic illness, issues related to hormone imbalances, and cognitive decline. So we'll be having podcasts that talk about those issues moving forward. So if you have something in particular that you're interested in, drop us a note. We'd love to hear about it and help us focus our energy really to help you.
Yeah.
So we have one more question here. Is there anything else you'd like to share with us before we sign off?
Yeah, I want to challenge everybody out there to try at least one of these water therapies. Maybe you already do. That's great. We'd love to hear about it. Just try something. Maybe, and I really want to challenge you with this because I love doing this, and I didn't think I would when I started. Maybe try a cool rinse at the end of your shower tomorrow morning or tonight, whenever you shower. Just try it. Just a little bit. It doesn't have to be even cool. It can be just tepidly warm.
Try it on your knee, Or
try it on your foot. Something. Just try it out. See what you think.
I think that's awesome. That's a good challenge. I want to hear from you guys. So you find us Blue Earth Medicine on Facebook, on Instagram. You can go to our website. You can leave us a comment. You can drop us a note. We would love to have you on our email list. So if you visit blueearthmedicine.com, you can drop off your email, and we'll put you on our email newsletter. So we'll be sending out another one here very soon.
Right.
So
another week or so.
I encourage you to do that. If you like the content that you hear here from Blue Earth Medicine Podcast, please, like it, make a comment, share it with your friends. If you have people that are like, I want to do it myself, I want to be my own healthcare, that's cool. These tips and tricks we give you here are things that you can take with you. If you want to know more about naturopathic medicine, do a Google search. If you're in Washington, in the Seattle area, or anywhere in Washington for that matter, because Dr. Jill does telehealth and in-person visits in her Bothell, Washington clinic, I think it would be awesome if you connected with her, because I think she's an amazing doc. So
I'd love to see you.
I love that to happen too. So I'm going to say goodbye here. So with this note here, Dr. Jill is a licensed naturopathic doctor in private practice in Bothell, Washington, serving as a general practitioner who focuses on family medicine, chronic illness, hormone imbalances, and issues related to cognitive decline. We'll be talking about brain fog here soon.
Great.
If you're living outside the state of Washington, Dr. Jill also accepts health coaching clients. So for anyone to book an appointment, visit her website at blueearthmedicine.com. And while there, sign up for our monthly newsletter for natural health tips, news, and podcast updates. From the Blue Earth Medicine podcast team, that's Jill and me, we're sending you healing energy, love, and light. If you enjoyed this episode, again, please follow, share, and join us for our next episode. Cheers.
Thanks, folks.